The following content is for informational purposes only and should not be considered medical advice.
Welcome to KC Wellness Talks. I'm Dr. Dawn Ipsen, pharmacist and your host. Join us as we delve into the world of healthcare with local providers discussing common health concerns many face and explore ways to overcome them. Whether it's simple tips from home remedies or the latest in treatment and technologies, we've got you covered. Today, I am so excited to introduce to you our guest, Dr. Gillian Ehrlich. And she is quite accomplished, and we've known each other a very long time.
Very long time.
So we are on quite a first name basis.
Yes.
In fact, we have done some other podcasts and such before and worked before. But let me take a moment to tell our listeners about you. Okay. So Dr. Gillian Ehrlich is an ARNP and also has a doctorate of nurse practitioner medicine. She's also a functional medicine certified practitioner. She practices, this is the cool part, she practices both conventional, functional, and ayurvedic medicine at Neuroveda Health in Seattle, Washington. I'm in her office today, and I have to tell you, oh my gosh, I could just stay here all day. We're on the waterfront. I have a beautiful view of the lake and lots of boats and such.
Yes.
She holds a doctorate of nursing practice from the University of Washington, is also certified from the Institute of Functional Medicine, and Ayurvedic trained with Dr. Vasant Lad at the Ayurvedic Institute. Where's that at?
So it was for 40 years in Albuquerque, and they moved 2 years ago to Asheville, North Carolina.
Oh, very cool.
Yeah.
Okay. Her interest in health led her to first practicing regenerative agriculture and guiding wilderness leadership programs in youth. In medicine, she has spent 10 years caring for homeless adults in acute and subacute care settings, and 7 years as an integrative primary care clinician in an insurance-based nonprofit, and that's where we met.
Yep.
Yeah.
When I was at Swedish.
Yeah, when you were at Swedish, yep. Her work at Neuroveda Health persists her focus on serving complex and chronically ill adults and children, which is such a great resource for our communities. There's not very many practitioners that do children.
Yeah.
As well as the neurologic mechanism of perception, processing, connection, ecology, and justice. So thank you for being here
My
today.
pleasure. So fun. Always fun to talk with you, and thanks for having me.
Yes, of course. Now, we, of course, talked by phone and kind of prepped where we wanted to go with this and what we thought might be most interesting, which was good because you as a provider, from my perspective as being the compounding pharmacist that you work with, you see a really diverse group of patients. Do you want to start us with that and kind of tell us a little bit about what does your practice look like? Who do you mostly serve and who do you help?
Yeah, absolutely. So let me start out by saying that my mission, I learned Ayurvedic medicine first 25 years ago. And I was at that time leading wilderness programs, working for a company called Pacific Crest Outward Bound School here in the Northwest. I was on these 26-foot long wooden open rowing and sailing boats.
Oh.
They were like replicas of the ship's launches that were here in the 1790s. So, you know, the big oars, just like Pirates of the Caribbean. Yes. And so we took those all over the San Juans. We would sleep 12 people on a boat at night, laying on the oars and under the decks, and it was really fun. And I went down to visit with a dear friend of mine, Anisha Derve, who I grew up with in Cleveland, and she was studying acupuncture and Ayurvedic medicine with Dr. Ladd, and she had me sit in on some classes. And what I learned about the Ayurvedic framework, the idea that at the moment of our conception, all the forces acting in the universe can combined into our unique constitution. There's never been a you before. There will never be a you again.
Right.
And so health for you might be poison for me.
No, true.
Right?
Yeah. I mean, you know, each to their own and very
exactly.
different constitutions, right?
Yep,
Yeah,
exactly. So that was how I got really interested in Ayurvedic medicine. That's how I learned it. And then I applied it that summer. This was the summer of, I think, 1999.
Okay.
Yeah, this was the summer of 1999 with all my Outward Bound students. And so I distinctly remember playing around with what I had learned, and it was so spot on. My teaching improved, my understanding of people improved, my annoyance really reduced. I was like, I was no longer annoyed that a person who could do something, who could learn something quickly now, quickly then forgot it, because I learned that the Vata constitution learns quickly and forgets quickly.
Okay.
And I remember working with a Kapha kids. Kapha is the constitution that's stout, stable, can live forever, but it's also they learn slowly, but then they remember forever.
Okay.
So I remember this kid I was like, I'm going to try this out. So I taught him how to anchor the boat, 15 steps. I spent an hour talking about it. And a week later, I was like, anchor the boat. And he's like, okay. And he did beautifully. And I never would have challenged him that way before learning Ayurvedic medicine. And so then I got interested in medicine because it's not only preventative care and the psychology and optimizing our health, but it's also about optimizing our experience of life.
Right.
And then all the diseases, all the ways that things can kind of go sideways, and all the tools that we have in our whole world being medicine in order to correct them.
Wow. Okay.
So I went back to school and I did prerequisites. I was a nurse at Harborview in our downtown hospital.
Yeah.
Mission-driven hospital.
Really?
Yeah, for 8 years.
Okay.
So I was on the floors for 8 years.
Okay.
And then I was in their medical respite as a nurse practitioner for 4.
Wow.
Working with homeless adults who needed acute care.
Okay.
Things that you or I would go home for, but if you don't have a home, you can't be non-weight bearing. You can't do brace care. You can't do IV antibiotics. You can't do a daily chemotherapy if you're trying from a different location to wake up in the woods every day and get to an appointment. And so we did really good wraparound care, and I love that.
Yeah.
But ultimately, I came to primary care at Swedish here, and then studied with neurologist Eileen Ruhoy for the last kind of 7-ish years. And what Dr. Ladd, and the whole reason I'm telling you this story, it will wrap around to a point.
No, of course.
But Dr. Ladd used to always say, people come to Ayurveda last. They have to exhaust all of their options before they come to Ayurveda.
Okay.
And I don't think it's that way traditionally in India, but even I lived with a gal in nursing school who was from India, and she's like, Ayurveda, my grandmother's medicine. And so it was, so I think that there is some level of, there are some folks obviously that really respect it and honor it.
Right.
And then there's some folks that feel like, it's old people stuff.
Really?
And I would say things then like, well, yeah, you should never eat yogurt on a cloudy day. And she'd say, ugh, my grandma.
Oh, gosh.
Because it won't digest well, and then you end up with autoimmune disease.
Okay.
So all that to say that I got into this current population out of kind of that experience, which remained true, which was that folks come to, if medicine works for you, then you don't seek further.
Right.
And so it's these really complex, chronically ill patients, or folks looking for longevity, or folks who don't tolerate conventional medicine, conventional therapeutics, or or have a conventional diagnosis, that end up really seeking Ayurvedic medicine, but then also functional medicine and kind of this cutting edge of neuroimmunology. All these things are kind of on the fringe. They're not necessarily uptaken robustly in conventional medicine just yet.
Right, that's probably true. And as you mentioned, that was a good way to look at it, is that everybody is going to respond differently, and there's a good percentage of the population that typical, we call it Western medicine, Western medications, where there's 2 doses available. It's going to work fine for a lot of people.
Yep.
But I think in both of our professions, our world that we are here to serve and who we help is the what if, and the people who that doesn't
work for.
Resonate and doesn't work, or makes them more ill too as well.
Yes, absolutely.
Okay. So within that, tell me a bit about like what are some of the common conditions and
So we really talk about our, I would say, most population is really what we call the pentad patient.
Okay.
So the pentad patient, and this really started out as the triad.
Let's add a few more arms. It's fine.
I know, exactly.
Yeah.
So the original triad was dysautonomia, so dysfunction of the autonomic nervous system, which can be the most common or the most well-known as POTS, postural orthostatic tachycardia syndromes. But then also MCAS, or mast cell activation syndrome, which is different than systemic mastocytosis, which is what's commonly taught in med school about how the mast cells, or this particular cell along surfaces in the immune system, go sideways. So mast cell activation syndrome, these are folks like allergic to the world. And then connective tissue disorders, and these can be innate or congenital, something like Ehlers-Danlos syndrome, or especially hypermobile Ehlers-Danlos syndrome, but all of the EDS syndromes have some type of connective tissue disruption genetically or acquired. So that can be mixed connective tissue disease. You can have antibodies as an acquired condition.
Okay.
So this is kind of like, and I think that it's important to recognize the difference there. I think it's really helpful for patients to understand. So in a congenital condition, it's kind of like the bricklayer laying the bricks of your connective tissue, which is the most common tissue in the body, and this is our skin, this is all the tissue around our organs, these are all the walls of our vessels.
Right.
So connective tissue makes up a lot of tissue.
Holds it all together, keeps it functioning in the right areas.
Yep.
Yeah.
Blood, ligaments, tendons, all of these things are connective tissues. So either the bricklayer doesn't have the right tools,
right,
or doesn't have the right knowledge how to build the wall.
Yeah, or misses a step.
Or misses a step, yep, exactly. Or, and that would be congenital or inborn, versus an acquired, which is like that bricklayer is so stressed out that he or she cannot build the correct wall.
Okay.
And so that can last a succinct period of time, or that can be a lifetime.
Okay.
That bricklayer is like too distracted, is hungry, is like watching something else, and can't lay those bricks correctly. So what it might look like might be the same in terms of connective tissue dysfunction, but I do think it's helpful to know, is this congenital, is this inflammatory?
I see. All right. And so you mentioned one of the conditions in there, which you and I work a lot with together and different treatment modalities and things like that, MCAS.
Yes.
And I think that that's an area that would be really interesting to our listeners, and especially such a great expert that you are in this field. So you mentioned it's different than what is taught in traditional MD training. Let's talk a little bit more about that, because you mentioned histamine and how that plays an effect, but how is it different?
So systemic mastocytosis is really a cancer of the mast cells. And so what a cancer is or a neoplastic condition is when cells divide out of control.
Right, okay.
So it is really it is strangely unusual to see a person whose pinky finger has grown beyond the rest of the height of the other fingers.
Right.
So uniformly on like the majority of in fact, in my entire life, which is now 50 years as of last week.
Congratulations.
Thank you. I've never seen a person with a pinky finger as their longest finger.
Right.
And so there is really clear stop mechanisms on tissues.
Right.
But in a cancerous tissue, that doesn't happen. And so you have too many mast cells.
Okay.
And they degranulate, and they spit out when they degranulate, they pop open with a threat.
Okay.
And our body is trying to save us. So this part of the innate, the frontline immune system, pops open these bubbles of mediators, and it releases over 1,000 chemical mediators.
Right.
Some of the main ones, which are histamine, leukotrienes, prostaglandins, heparin, and so you can have things like pain, bruising, laxity, and then all of the histamine symptoms. And we have to remember that histamine also can act like a neurotransmitter.
Yeah.
So anxiety is really common, and that is not necessarily an anxiety that you can resolve with therapy, because it is simply a chemical mediator that is being released into your body by this other trigger.
Right. Okay. So
so mast cell activation is not neoplastic. You don't have a greater number of these mast cells. They just misbehave. And so the way that the analogy that I usually give patients is like, if you're standing on a busy street corner holding the hand of a small child and a fast car comes by, it's natural to say, oh, step back a little bit. But these mast cells are like, get back! And it's like they throw the child 20 feet. And so the perception is clear, the intention is good, the outcome is undesirable.
A little aggressive.
It's an aggressive outcome.
Yeah. And so, I mean, usually when we think of histamine, we think seasonal allergies, we take an antihistamine, and life goes on. But sounds like the bigger problem here is that not only is histamine released, we have all these other mediators as well, in which then therapies and treatments and everything becomes complex because, like you mentioned, they're reacting to the world.
Yes.
And their world. Yeah.
Yes. And so I think we're seeing more and more mast cells. When we think about it, our body is reacting to, our immune system is responsible for constantly assessing, are we safe or are we not safe in the world?
Right.
And so it is a constant game, because if you're not safe, that has to be the primary thing that your body does to keep you alive and for survival. And so that perception of not safe, when you think about the things that actually have kept us safe, evolutionarily speaking, it's really been our microbiome, our nutritional balance, our sleep and restoration balance, our water, our movement, the bidirectional conversation between our muscles and our brain. And so when we like sit in a cubicle, don't move our body, don't breathe good air, don't exercise, eat a lot of processed foods, leave lights on all the time, and don't get enough natural microbiome. And then on top of that, we add this burden of pollution that's really been released since the chemical warfare started in World War I, right? So, and then those chemicals were turned into pesticides and herbicides and sold en masse.
Right.
And then after World War II, it's really been 80,000 chemicals released into our environment.
Oh my gosh.
So there's now, there's more and more, there's now 2 articles that I know of that are documenting the microplastics in atheromas or the microplastic, like even in June 2021, right? So this was like heart of the pandemic.
Yeah.
Flights were reduced, people weren't traveling, and there were microplastics in the air over Yellowstone. So if you think living rurally will save you, definitely the concentration may be less.
Right.
But, they're still there.
And it's in our water, it's in our food, it's in our air.
Yes.
Yeah.
So we have less supports because we don't have the microbiome and the movement and the muscle stress that is actually helpful to us.
Right.
And we have more burden to manage. And so our immune systems are like, shit, what are we going to do?
Yeah.
And so there's a lot more and more overreacting is happening in those mast cells as they try to protect us. So these are folks who are often allergic to the world, but symptoms can range because mast cells are on surfaces.
Okay.
And so because they're barriers, right?
Right.
They're surface soldiers. So, and there's a lot of them. And again, they can get confused, but they're on skin, they're on GI tract. Because, we're built like a long, tall donut.
Right. Yep. A big old tube.
A big old tube. You could put a string down one end, it will come out the other.
Yeah, that's true.
So when you think about what is your skin, it's really your skin, but it's also your GI tract is kind of like an internal skin.
Right, the mucosal membranes.
Yep, and we really exist between our GI tract and our outside skin.
Right.
Like a donut.
Yeah,
true. Like a long, tall donut. So, sorry, so gross.
Yeah,
so,
it's where it's the fact of the cellular makeup.
It's the fact of exactly.
Yeah.
Can't argue with that. So, so GI tract is a big one. Okay. Sinuses, nasal, sinuses, respiratory, bronchial, lungs. So that's a whole tract that is essentially a tube into our body that is a surface. So asthma, recurrent sinusitis, nasal congestion, rhinitis. And then our genitourinary tract. So a really common symptom with mast cell activation is actually what's called interstitial cystitis.
Okay, yes.
Or aseptic cystitis. So it's like you have a UTI, urinary tract infection, but you check over and over and over, and there's no organism
bacteria,
ever found. And so it's like, do you treat or not treat? And what's most likely happening, in my experience, is this interstitial cystitis. You have a mast cell inflammation of the bladder lining or the urethra.
And very painful.
Very painful, very disturbing. Yep. Right.
So what is the prevalence of MCAS? Like, obviously, your office is busy, you're busy.
Yes.
You're growing, you're adding more providers to help with our community need. So it's not rare. Am I thinking right? Like, what are we talking about for prevalence, and who's the typical, what's kind of typical for, is it men, is it women, is it certain ages? What are you seeing?
I mean, honestly, I see everything. So it's kids.
Okay.
I have a lot of kids. In fact, one of my early success stories was a 6-year-old who was having vomiting and rashes, was really irritated by tags, and was having mood symptoms in school. Like, couldn't pay attention in school, was restless, couldn't sleep, was irritable, wasn't listening to his mom. And that mom has a good handle on those 4 kids. And so this was a 6-year-old. And we actually took him off of gluten and started him on ketotifen and I think cromolyn, and all of those symptoms resolved.
Whoa.
And that mom was great because she was like, you've turned me into a hippie. Now she's like, now I've taken out the chemicals. It was like previously using Tide detergent.
Sure.
And so now it's gone to all the fragrance-free things. And that kid is still doing well. But a lot of she said at his school, if there's ever a kid who feels restless, who they can't control or can't contain, you can look at trauma and the life, but you can also look at this histamine component, at this mast cell component. So a lot of children, if they get a mosquito bite and it's this big, Skeeter syndrome.
Yep.
Think about mast cell activation.
Right, because the histamine is kicking so high. Yeah. Okay.
And then I also see a ton of men and women, all the way through into the 80s and 90s.
anything profoundly, I mean, you said environment, but like, and you mentioned trauma-induced too. So is there a connection between a traumatic life event or a traumatic birth or a traumatic something going on that then triggers this to become a condition or a disease or something that's completely flared?
It's a great question. I would say that there's a lot of controversy in the field because being allergic to the world is really stressful.
Yeah.
So what's the chicken and what's the egg?
Okay.
Does being allergic to the world drive these symptoms, or do these symptoms then drive this physical response? And I would say it's probably a little bit of both. There are some studies that we're actually embarking on now, and some papers that have come out that say that patients with this triad, I never finished the pentad, but the triad or the pentad do have a higher burden of neuropsychiatric symptoms, but it's hard to tell exactly why that is.
Okay.
And what we know from the ACEs study, the Adverse Childhood Event study of the late 90s, with Vincent Felitti, that if you have 4 or more ACE events, adverse childhood events, and you can find what those are online, and it's a great test to do for yourself. Wow. There's a higher burden of disease in adulthood, and it's things that you wouldn't necessarily expect. I mean, it's heart disease, but it's also like COPD and bone fractures. I mean, so it's just when we have our autonomic nervous system is separated into that parasympathetic and that sympathetic.
Right.
And if you spend more time in that sympathetic state, you spend less time, I mean, it seems obvious, in that parasympathetic.
Right.
And that parasympathetic is where we're doing digestion, cellular repair, reproduction. And so Robert Sapolsky is a fantastic Stanford researcher. Do you know him?
I know the name. I'm not super familiar with his work.
He's so funny.
Oh, gosh.
He's really funny. But he says digestion, reproduction, and cellular repair are optimistic and expensive endeavors metabolically. So your body only engages with them if it's convinced there will be a tomorrow.
I see. Okay. And another way to kind of word what you're talking about is, are you spending majority of your time in a fight or flight?
Yes.
Constantly
Yes.
go, run from the tiger, next thing, never relaxing? Or do you allow yourself to get into that rest, relax, recover state in which the digestion, the sleep, the reproductive? Okay, but finish the pentad. We got to do that first.
Okay.
Yeah.
Okay, and I will say with Robert Sapolsky, if you want more of his information, he wrote a great book in the late 90s called Why Zebras Don't Get Ulcers.
Oh, I've heard of that book.
And so that book is like, zebras don't get ulcers because the weakest is taken down by the lion.
Yeah.
And then they literally move like 10 feet away and resume eating and reproducing.
Oh my gosh.
And years ago, I had my cousin read it, and he was like, okay, I had to stop because I was getting stressed out. And I realized that every time I couldn't find parking, I was like destroying my body.
Oh my gosh.
So all that to say that information can be really helpful. That book can be really helpful for going through what's happening.
Yeah.
But when you're in that sympathetic state for more time, I think it's a natural outcome, which is that you're spending less time in healing, restoration, stability. And so because of that, your mitochondria are probably getting more tired.
Right.
And there probably is a shorter fuse for a mast cell activation syndrome type of conditioned response.
Wow.
Okay.
We all need to go take naps and eat an organic salad and stare at this beautiful water view for the rest of the day.
Lay on the earth. Just lay on the earth.
Oh, yeah, some grounding.
Yeah.
Yeah, that sounds pretty good.
Yeah, I know.
Yeah.
I'll do that.
Yeah. Do you want to hit the pentad?
Yes. So the pentad. So we talk about innate immune dysfunction, which is mast cell activation.
Okay.
We talk about acquired or adaptive immune dysfunction, which are antibodies, that second leg of the immune system. So that's going to be your long COVID, your recurrent or chronic EBV, your Lyme, your mold. All of those things are going to be chronic adaptive immune dysfunction.
Yeah, and we're seeing
autoimmune disease.
So much of that. So much of that, especially in the last 3-4 years.
Yep.
Yeah. Okay.
Yeah, a ton. We're going to have the third part of the pentad now, I say, is neurologic changes.
Okay.
So this might be gastroparesis. This might be small fiber neuropathies.
Okay.
This might be dysautonomias, because the autonomic nervous system is part of the nervous system. So that POTS component, so neurologic symptoms.
Okay.
Then we also see in this pentad is structural disruption.
Okay.
So if that bricklayer can't lay those bricks, either innately or acquiredly, that's not a word, but in an acquired fashion.
Yeah, either from birth or as part of life moving forward.
Yes. Exactly. So structural disruptions, and so those can be membrane disruptions, connective tissue disruptions that disrupt cellular signaling that can create a chronic inflammation. And so we think about even things like CCI or cranioscervical instability or TC, tethered cord.
Oh boy.
So those are ways that our cerebrospinal fluid flow can be interrupted, and you can have chronic fatigue and a lot of other symptoms from that.
Okay.
So we see a lot of those patients. And then the fifth part is the microbiome disruptions. And so we see a lot candida or yeast, or we see a lot of SIBO, small intestinal bacterial overgrowth, or SIFO, small intestinal fungal overgrowth. So those are the 5 things: innate immune dysfunction, adaptive immune dysfunction, neurologic symptoms, structural disruption, and microbiome disruption. That's the pentad. So that's who we see. In a nutshell.
Simple. You've just made it simple. Elementary, my friend. Elementary. Hardly, right? Oh my goodness. So how do you go down the track of diagnosing or trying to help people put a name to what might be going on, to these symptoms? Because probably clearly, I mean, maybe I'm making an assumption here, but I would have assumed by the time, like you mentioned, that they're seeking Ayurvedic, they're seeking a different way. They've been around the block. They've been probably told, it's in your head, nothing's wrong, your labs look beautiful, we don't know why you feel that way. Take a vitamin and eat some good food and you're going to be fine.
Yes.
Okay.
So the best analogy I ever heard was, it's the idea, like in those places where there's a forest and they essentially cut down the forest and then they dam it up and then it fills with water.
Yeah.
And so you can see sometimes these tree stumps sticking out.
Yes.
But if you were to drain the water, you would see that the root ball is connected underneath.
Lake Cat cheese is totally coming to mind.
Yes.
Anybody in the Washington area needs to drive
like,
I-90 and take a look at Lake Cat cheese, which is always amazing to me.
Yeah.
But that's a great analogy.
Yeah, it is. And I'm like, oh yeah. So when I see any one of these, I look for the others because I know that they are often connected. And patients don't often connect them, especially because if you have so many symptoms, then some of them you just either forget about or they're not the most important thing today.
Right.
And so the way
to cope.
You learn to cope. Yes.
Yeah. Or that thing. I didn't even know that was a thing.
Exactly.
That it was normal.
So I saw a patient I saw this morning when she first came to me. When we started treating her mast cells, she came to me for something totally unrelated. But when I heard her symptoms, I was like, I think you might have this. And we started treating her for mast cell activation. And she was like, I did not know. She's 61 years old now. I've been seeing her maybe 4 years. And she said, I did not know your nose was not supposed to run after you eat food. But she said, but now I realize because every time she ate, she was releasing mast cells. Mast cells were releasing histamine and she was getting a runny nose.
Right.
So a lot of times these symptoms that people think are just part of life often do go away once you start treating. So I look at what is the person's priority.
Okay. Help them narrow it down. Let's get a goal.
Yep.
Therapeutic goals here.
Yep. And then I start, and I also look at what is their most invasive symptom or interruptive symptom, and what is the most possible for them to change.
Okay. Right.
Because those are not always commiserate. It might be that sleep is their biggest complaint, but I'm going to try and control their pain first because that might help with the sleep component.
Sure.
And so, or however it goes. But that's how, I take the symptoms, and this is the detective part that is super fun.
Yeah.
With patients is trying to put together, my husband always tells me it's like Minority Report. There's that movie where they're like, they put it all together.
You're working the board.
You're working the board. Yeah, exactly. That's what the patients are.
Yeah.
And that's what you come to me for. So you are the expert in your health and in what your symptoms are. And my job is to Minority Report.
Yes.
To come up and spit out like a step-by-step program.
Right.
There where we can unlock things. Right. And sometimes the worst thing or the hardest symptom is not what we can unlock first, but we have to essentially take the burden down before we can get to that bigger Gordian knot.
Right. And to find what they're willing and able to invest time, energy, resources, whatever it might be.
Yes, exactly. And I have some patients who are like, I cannot change my diet right now. And so I'm like, okay, so what are we going to go for? So what I'll say with mast cell specifically is it's very hard to diagnose.
Okay.
Because there are so many symptoms, and because by nature, those chemical mediators degrade really quickly.
Okay.
So there is a panel that we will send to LabCorp or Quest where patients can get their labs drawn. But often they will be negative because if they leave them on the counter for a half an hour, those mediators degrade. They finish degrading in the warmth, and then you don't find them positive. So I'll often try to encourage patients, like if you're collecting a 24-hour urine for prostaglandins or for histamines, you put your container into the fridge, and then every time you pee, you put it in. You don't pour it directly into that container warm because then you'll rewarm that pee that's already there. So put it in, let it cool, then pour it in.
Wow. Okay.
And then use the next one, and then take it to the lab in a bag of ice.
Okay.
And so there's all these ways to try to keep it cool to actually catch these mediators.
Yeah.
But it's tricky.
Yeah.
And they're in mast cell activation syndrome. There are a couple of different, there's a consensus 1 and a consensus 2 diagnosis.
Okay.
Consensus 1 is based on tryptase, which is one of the mediators that is elevated in systemic mastocytosis and is most typically normal in mast cell activation syndrome. So
okay, so you would run it and you would find a normal result on that.
Yeah, so tryptase is often normal.
Okay.
But in consensus 1, it is one of the main markers to diagnose mast cell activation syndrome, which means you're not really going to catch anybody.
Right, because it's probably going to be negative.
Yes.
Okay.
And so in consensus 2, we look at a variety of mediators. So this can be leukotrienes or prostaglandins or chromogranin A or histamine in serum or histamine in urine or prostaglandins in serum or urine or heparin levels.
Okay.
So we look at a bunch of them, but really in consensus 2, it's about the trial. It's about the symptoms, and it's like symptom clusters of like 2 or more symptoms and 2 or more systems.
Looking at subjective data with and also look at some objective laboratory based as well. Paired together.
Yep. And then it's also response to treatment. So in consensus 2, you're really making the diagnosis after you've tried an antihistamine, cromolyn, DAO, diamine oxidase, which is a supplement that you can take for, which you sell at Clark's and Kusler's, which is a digestive supplement, and it's the enzyme that degrades excess histamine. So it's not a good preventative, but you can take it. You know, you can take it
to help manage the overall load.
Yes, exactly. But it's not an upstream modulator. But so then there's all these, so then you kind of treat mast cell, and if people improve, then you can call it mast cell activation syndrome.
Check the box. We're there.
And then I look for all the other things. So for dysautonomias, you can do autonomic testing, which we offer at our clinic. We're one of 3 locations in Washington State.
Wow.
So University of Washington, autonomic neurologist Eric Armentano and us have autonomic testing.
Wow.
We do you can also do a NASA lean test. So NASA at-home lean test.
Yeah.
And I don't love that as a diagnostic tool, but I do feel like it gives us a sense of what's going on.
Okay.
To look at adaptive immune dysfunction, we're looking at antibody panels through LabCorp Quest or specialty panels like Cyrex or Vibrant America or CellTrend or, just these huge variety of antibody panels. To look at microbiome disruption, where you can do for SIBO, to look for SIBO, that's small intestinal bacterial overgrowth. It's breath testing, so you drink lactulose, actually.
Oh my gosh.
Just like my old liver days.
Yeah.
But it actually gets fermented, and then you exhale into these tubes every 30 minutes for 3 hours. And then they look at levels of hydrogen sulfide, and methane gas to determine what's in there. Or you can do stool testing for candida or to look at the microbiome.
Yeah.
And then CCI, like the structural components. Our naturopath here, Carly Squires, can do a manual cranial traction trial.
Oh, wow.
And do some tests for kind of tethered core type of symptoms.
Oh, my goodness.
So we can do all the diagnosis here, but they're definitely like not cut and dry. It's not like a urinary tract infection or like...
Right. Here's your bacteria, treat it, move on.
Yeah, this is not pink eye.
It's happening.
Sometimes I dream of pink eye, but this is not pink eye.
Wow. I think you'd be bored.
Yeah.
Yeah.
I mean, it's always satisfying treating something like that because you're like, this is it.
Simple. Here's the result. And we're done.
Look, I fixed you.
Yeah. But also really cool to be able to have an opportunity where you are pairing in that subjective, that feedback, that response piece.
Yeah.
What is the patient saying? What are they feeling? What does it sound like, feel like, et cetera.
Yeah.
And then, boy, it sounds like a myriad of objective data, whether it be urine or serum, which is blood testing, or stool testing or breath testing. Or manual testing.
Yep, and we also do skin biopsies. So we'll do 3 little skin punch biopsies, and we can look for small fiber neuropathy. We can count the fibers in the nerves, the number, and see if it's reduced.
Oh my gosh.
And then we also look for amyloid and alpha-synuclein depositions. So that the alpha-synuclein is more and more associated with Parkinson's.
Okay.
And then amyloid, we use with Alzheimer's in the brain.
Yeah.
It doesn't. If you have amyloid deposited in your skin, it does not mean you're going to have Alzheimer's. But there's this sense that I always think with my ulterior life, I always want to work at the Gap.
Oh,
I'm like, I could just fold clothes and talk about outfits all day, because it's like, and I think about that and it's like relieving to my mind.
Yeah.
But when I think about amyloid, or like explaining amyloid or alpha-synuclein deposition and why that's a problem, it's because they're often misfolded proteins. So if you think about a really, really busy day, if you think about Black Friday at the Gap, it's kind of a disaster.
And for sure.
So the more stressed your body is, the more misfolded proteins it's going to deposit around through your skin.
Okay.
And so that's why we look for those.
Oh, that's crazy. I love your analogies. We've got lakes with broken off trees, and we've got the Gap and folding clothes, but it makes sense. It makes it really realistic. Awesome. So, and that helps you with the differentiation too, I assume. All these different tests, all these trying to put the puzzle pieces together, trying some treatments to see how it goes, to determine, is it all 5 pentad that are being affected, or is it partial or not? Am I right on that?
Well, and sometimes it's about the progression, because these conditions that are so deep and long are going to be, we're looking at what the snapshot is now, because once you have it, you're probably going to be managing it for a long time.
Okay.
And maybe not. Like, I definitely have patients who have come to me with problems. I had one patient come years ago with mast cell activation syndrome, and she came to me with a prescription in her hand for Cellcept. Which is mycophenolate acid, which is a pretty intensive and immunosuppressant.
Yes,
for
absolutely.
3 years of symptoms. And I treated her with cromolyn, antihistamine diet, some trauma work, and a couple other mast cell stabilizers that were herbal. I don't think there were any other pharmaceuticals. And lo and behold, she did get better.
Wow.
And she never took that Cellcept, which especially...
Probably good.
Yep, heading into a pandemic, that would not have been good. This was before... This was like in 2016, 17.
Oh, gosh.
And she's, I haven't seen or heard from her in years, but the last time she came to see me, she was like, I just want to say thanks again, like I'm doing okay. And I know how to treat myself now. I know how to modulate things so that I don't get those symptoms. I can tell when I'm on the edge, and I know what to do to back it up.
Oh, my gosh. Oh, that's incredible.
So there's there's a really interesting concept in Ayurveda called kavaigunya, which technically means vulnerable space.
Okay.
And we know that in the Western world, if you sprain your ankle doesn't stay sprained forever.
Right.
But you know that if you're running and it's dark and it's, it's late and the ground's uneven and you're hungry and cold and tired, you're much more likely to sprain that ankle.
Right.
But that happens all over the body in Ayurvedic medicine. So essentially, when I see this pentad patient or triad or any of these mast cell activation syndrome, I think about it as sort of like a sprain in the immune system.
Okay.
So it doesn't mean your immune system is always going to be sprained, but it means you always have to watch it. You always have to make sure that it's not cold and dark and you're tired and hungry and you're running on an even ground.
Right.
So sometimes you can prepare for that. Like if you're going to have dinner with the president, you want to you want to institute your safety mechanisms ahead of time.
Right.
Or if something happens to you, like you're in a car accident or whatever, then you know the things to go to immediately to stabilize everything.
Calm it down quickly. Yeah. Oh, that makes a lot of sense.
So it's that kavaigunya that I try to teach patients about.
Yeah. Oh, that's awesome. But it's true, and it makes sense, and it changes. I'm sure it changes seasonally and depending on
that's exactly right.
mood and food and sunlight and
menopause state, like
hormones.
perimenopause, hormone fluctuations.
Yeah.
Yes, we are never still.
Right.
We are never still in this life. Right. We are constantly able to change our perspective.
Yeah.
And in fact, we have no choice.
Yeah, and we probably will need to and should and have to, and it's part of life for sure.
Yeah.
Okay, but let's talk a little bit about like treatment, you know, and what are some of the things that can be picked off and can be helpful in different scenarios, and I'm sure there's lifestyle, and I'm sure that there's diet, and I'm sure that there's medicine, and I'm sure that there's ayurvedic, and so where do you go, where do you start, or what's some of the first initial thoughts?
So I mean, again, I start with either what's the most severe for the patient, or I start with what's most possible. Because I want early, easy wins, because hope is carries a lot of weight in the immune system. If you're, again, that digestion, reproduction, and cellular repair are optimistic endeavors. So I need to have some optimism on my side. And so I try for a few easy wins. If this is mast cell activation syndrome, again, we're looking at symptoms like rashes, headaches, GI symptoms, which can be gastroparesis and constipation, or a lot of diarrhea. We see a lot of diarrhea. A lot of indigestion, a lot of pain in the stomach after eating, a lot of gas and bloating. And so I'll often try and start there, and I'll often try and start with something like cromolyn. And cromolyn there are commercial and there are compounded products. In my experience, most people will tolerate the commercial products, but it does come in a little plastic, what we call fish, like it comes in a little plastic tube, and sometimes people are like, I can't do that plastic. And so then we'll order it compounded, or people will say, I can't do that liquid, in which case, you know, or they can't get their kiddo to swallow liquid, but they can do a powder or a capsule, they can hide it easier. And so then we can order it compounding. And in my experience also, it waxes and wanes in terms of availability.
Yes, it definitely does. Talk about drug shortages and situations.
Why is that? Now I want to interview you.
I was just in Washington, D.C. last week.
Yes,
and this
you
is
were.
exactly what we were talking about, was drug shortages and why is this a problem. And I think maybe next year there might be some good efforts to work towards legislation that might have a positive impact on that. But but the good thing, I guess, is, and this is not to diverge from where we're going, but it really peaked during COVID, and it's not really getting better is the big problem. And so it is of great concern to lawmakers, to healthcare professionals, and so there is some good movement behind it to put some good focus on it so that patients do have access to basic medications within the United States of the America.
That would be nice.
But you're right. Cromolyn is one that is constantly goes on and off of availability from commercially manufactured formulation, which is liquid. And we do compound it quite regularly because of that, and also because it only comes in that liquid formulation. And a lot of patients really would prefer to take a capsule with that medicine inside the capsule. So, exactly. Oh, that's interesting. So what else comes to mind from a treatment standpoint or a modality standpoint that can get you some of these easy wins?
So the easiest wins are often with antihistamines. So that can be H1, which are kind of your Benadryl, your cetirizine, your loratadine, Zizal. So those are all H1s. And then H2s are things like ranitidine or famotidine. So Pepcid or Prevacid. And so often those are easiest because they're cheap, they're available, and you can just take them over the counter. And I will say, in this mast cell world, I'll often go to higher doses than I ever thought that I would for allergies. But if it keeps the person from having any kind of anaphylaxis or keeps them out of the hospital, then I'm pleased, or lets them sleep at night. And then there are some antihistamines which we don't think about a lot, but we can use. So that could be something like hydroxyzine or cyproheptadine, especially for children, can be really helpful.
Both prescription formulation type medicine. Well, cyproheptadine you can get over the counter in certain doses, but
And so those antihistamines are kind of early wins. But I will say that a lot of those antihistamines will use weird dyes and fillers and vehicles. So we do, if somebody reacts poorly to a commercialized antihistamine, then I will often try it compounded before calling it quits with that med.
That makes a lot of sense. And, you know, it leads me back to that great podcast we did on excipients. And I know that is still out there in the world. So if you want to hear more about the excipients or the inactive things that are in commercially available medications, whether it be tablets or liquids or whatever it might be, we did a whole hour plus, I think, on that topic alone, because it does profoundly impact patients. And unfortunately, a lot of times it's hard for a consumer to even know what are those things that are in medicine that they might be reacting to, that they think it's the medicine that's causing the problem, but it's actually, you know, some filler or some dye or some preservative or some whatever it might be. But yeah, that's interesting.
And I will say one really good resource is DailyMed.
Yeah.
DailyMed what is it? It's not .gov, but it's
is it a .org? It might.
I don't. If you Google DailyMed, like government, I think it's like .nlm or something, but I don't remember why that is. National Library of Medicine, maybe.
Yeah,
I don't know. So DailyMed something or other. Just go right there. But that can be really helpful for looking at the different brands and what the commercially produced. So again, this is not compounded meds.
Yeah.
You can tell folks what's exactly, if they want to know, you can say this is exactly what's in your meds.
Yeah, absolutely.
But for commercial products, if you're trying to narrow down, you can see what has polyethylene glycol or whatever other kind of filler. So that DailyMed can be really helpful for at least putting your meds together that might be
from a consumer advocated way of if a person wanted to take it upon themselves to truly understand, and then you would need to work with their pharmacy to, I can only take XYZ manufactured version of this, and see if the pharmacy will work with you and if they have access to that particular manufactured form of that medicine.
So, and I think I didn't realize, you know, so like just say Benadryl, there's, you know, 20 to 40 companies that might make Benadryl. When you think about Benadryl, you think about like, oh, there's got to be one plant where they make all the Benadryl, and that's just not the case. No. And so there's the active ingredient of diphenhydramine is one thing, but then there's all these fillers that go into it. And so if you're not having if you have a bad reaction to Benadryl, it may well be one of those fillers.
Probably
and so you might need, yes, exactly. Yes, and so you might need a specific brand. And if you can figure, I have many patients who are like, I can only handle this brand of this medication. Yeah. And so, or a brand name versus a generic. It doesn't necessarily mean that the brand name has, sometimes a brand name has like fancier or more expensive ingredients.
Sometimes
not.
Sometimes it's name and marketing.
Yeah.
You know.
Yeah.
That's very true. Like the sports world of NIL, you know, name, image, and likeness, and the ad, the commercial, the fancy name, the pretty color. Yeah. Yeah.
Yeah. So there's So figuring out what brands you might or might not tolerate, it can also be helpful.
Yeah. So what else are we missing when we talk about MCAS and we talk about the pentad that you think would be important or helpful?
So the one thing I think about with mast cell also, very early for good wins, is an antihistamine diet or a low histamine diet.
Like a FODMAP or?
No, there's actually low, so foods will have histamines.
Okay.
I think it's the worst diet.
Okay, good to know. Good, because I didn't want to do it. So.
I know. I think it's the worst diet, but I also think that it's a diet that is, if you reduce your histamine load, it's better than, you don't have to be the most, like people with celiac cannot handle like one stitch of gluten. Right. But with the low histamine diet, low is better than none. Some is better than none.
Right. Okay. So what do you like to go to, or what do you recommend to patients? How do they handle that?
So when patients come to us, we have, there's a website that we've used before that has, but you can also Google low histamine diet. Okay. And the primary thing.
I'm listening.
I know. The primary thing is not to eat leftovers.
Not to eat leftovers. Okay,
exactly.
Tell me more.
So when you make a big gorgeous pot of stew on Sunday, it sits and you eat it Sunday, you eat it Monday, you eat it Tuesday, you eat it Wednesday. Yeah. That whole time it's sitting in your fridge, like all the flavors are gelling in this beautiful way. Yeah. It's also that food has been cooked, so it is slowly degrading, and as it slowly degrades, it produces more histamines. Really? And I've had remarkable changes in patients by just saying, no more leftovers, or invest in some fancy silicone or get some mason jars. And so you make your gorgeous soup on Monday or on Sunday and freeze it in individual portions, because that's going to stop the histamine. That's going to interrupt that histamine production. Okay. And put them in the freezer and then take them out and heat to eat.
I see. Oh, I'm going to have to change my entire world. I am one of those who loves to make that awesome fall pot of soup and then have that for days ahead.
Yep.
Who knew?
Who knew? I know.
Gosh.
So I have had patients who have been like, I can't afford anything you're telling me, but I can go to the drugstore and get Benadryl or Claritin or Zyrtec. I couldn't remember Zyrtec. Oh yeah. But so I can do that, and I can not eat leftovers. And that's sometimes the easiest place to start.
Wow. Otherwise, any other diet things come to mind? I mean, the no leftovers, but I've heard things like shop the perimeter of the store, go for organic whenever you can.
Those things are always true. And foods that have high histamine are like, what has high histamines? I'm trying to remember. I haven't looked at the list in a while. I just refer patients to it.
Sure.
But kind of like deli meats.
Oh, okay. Processed
foods.
Yeah. Cured.
Fermented foods.
Okay.
So, fermented foods. Let's see what else. And then there's a whole list of foods that have higher histamines.
Okay.
So you can just look at that food list. But always, regardless of who you are, if you are breathing and eating, then you should be shopping the perimeter of the store, which means fresh. I mean, in the fantasy world, it's like organic food and it's fresh and it's local so that it's not having to be irradiated or travel a very long distance. You want to try, we underestimate the amount of ethical choices we make when we choose where we get our food.
Yep.
So something like CSA, food, community supported agriculture, is a great way to return that money to a small business.
Yeah, farmers markets.
Exactly.
Small grocery stores that.
And those foods, back in the late 90s when I was first looking at that, they were like, there's no difference between organic and inorganic. And now there's more and more studies come out about how much more nutrition there is, how much more nutrient value. Yeah. And in Ayurveda, our goal is to, we're always looking for prana or like chi in Chinese medicine. Yeah. And so the idea, and that a lot comes from kind of the sun. And so, so we're trying to eat as close to the sun. The chloroplasts, take energy from the sun to make their leaves and their tissues and their fruits and their berries and all their stuff. Yeah. And then we want to eat that as soon after as it's harvested and as it's grown to kind of capture that sunlight.
Energy. Yeah. This has been so lovely having you on today. You and I could just talk forever and ever. Yeah. So we need more viewing of water. We need more grounding. We need less histamine.
And in my mind, when you said it was so fun, I was like, now we should go have a drink and talk about all this stuff. But it made me remember that alcohol has a lot of histamines.
And often, depending on what type and what you're doing, sugars, right?
And sugars, yep. Yeah, and red wine is the worst.
Yes.
So for histamines.
Oh, for sure. Yeah.
Yeah.
Well, I have a gift for you also.
Oh, you're so sweet.
So I want to gift you one of our handmade Kusler's and Clark's Compounding Pharmacy pottery mugs. Oh my God, and these were mugs that we had designed for our staff as gifts, and then we have them also for providers and people in our community that are close and tied to us. So
this is so beautiful. Thank you so much.
I knew you would love it because of the pottery and the nice weight and the good feel.
Yes, exactly. And what's funny is when you first came in and I saw this mug, I was like, it reminded me. I was like, I have a mug that I love.
Right.
But I thought about it because I was like kind of jealous of your mug.
Well, you get to have that mug. I brought it just for you.
So sweet.
Just for you.
Thank you.
Well, thank you so much, Dr. Gillian Ehrlich. It's been great to have you. And
it's been great to be here.
Yeah, thank you for being on and for sharing so much valuable information. Could you please take a moment and remind listeners where to find more information about you, how to connect?
Yes, absolutely. Okay. So we are our clinic is Neuroveda Health, Neuroveda Health, HEALTH, neurovedahealth.com. And on our website, you can find all the resources. We also have a podcast that's on Spotify and 8 other platforms, and so it's the Neuroveda podcast for complex health. It used to be podcast for healing neurology, so a lot of the episodes do say that, but it's now Neuroveda podcast for complex health. And then we're here in Lake Union, and we do take walk-ins for IV therapy, and so if folks need a little tip-top, if you've had a night of drinking, we'll go back to the alcohol. If you've had a night of drinking, or if you have a migraine and you want to avoid the emergency room, we've got a lot of resources that are right here for you.
Right. And I assume your website is Neuroveda Health.
neurovedahealth.com.
Okay.
Yep.
And I know, because I follow you, that you're on social media as well.
I always
so
forget
tell me about
that.
your social media platforms.
So we're on Instagram.
Okay.
I'm trying to get better at that, at Neuroveda Health. We're on TikTok.
Okay.
I think, and we're on Facebook.
Nice. Yeah. Gillian does some great reels and some fun content and some easy quick bites of good health information, and she's obviously very entertaining to listen to, so I would definitely say check that out. Well, that is all for today's episode. Thank you so much for listening. If you've enjoyed what you've heard, please subscribe to our channel and give this episode a like. Be sure to share it with your friends, and stay tuned for more insightful discussions on health and wellness. Until next time, take care.
Bye-bye.